What can I do for you today?
I'm very worried about my elderly aunt. She's 92 and she seems sleepy, but she doesn't really sleep. And the doctor prescribed lorazepam. I'm wondering if you can help me understand why that, given that choosing wisely has some other recommendations about dealing with sleep for the elderly.
Okay. Can you tell me more about your aunt's sleep routine?
Well, she doesn't seem to have much sleep, but she has little naps along the way, and she doesn't like to sit up too long because her back hurts. And we do want her to be comfortable, so.
Okay. So with respect to sleep medications, such as the lorazepam that the doctor has prescribed for your aunt, it's been shown in studies that people may get about 20 minutes more of sleep per night. However, there are risks associated with this type of medications, especially in older people. So for example, they may have an increased risk of having falls and also fractures as a result. And some people would develop problems with thinking and memory, and they may get confused. So I think these medications are best to avoid as a first-line treatment in older people who have sleep problems.
I'm really surprised that for 20 minutes, there's all these risks involved. Are there some other alternatives that we can look at?
Yes, so there are some strategies that are not medications that your aunt can try. So these are what we call sleep hygiene strategies. So for example, she should only go to bed when she feels sleepy and not to use the bed or the bedroom for anything else other than to sleep. And also, if she's not asleep within 20 to 30 minutes, she should leave the bedroom. Other things that we should consider would be to avoid any caffeinated beverages or drinks, like tea, coffee, especially late in the day. And as well, if we can have more activities or interaction with your aunt during the daytime, that will prevent her from having to nap or having daytime sleeping. And that hopefully will help her to have a better sleep at night.
Yeah, we have noticed that if she's interacting, she doesn't complain so much about the pain and wanting to lie down. So that's something really good we could try.
Okay, that's great. And then there's something else that is also not a medication. It's called cognitive behavioral therapy, or what people will call it as CBT. So these are usually delivered by clinical psychologists, and they consist of educational sessions on insomnia and sleep hygiene that we have just talked about, and sleep restriction and also relaxation type of therapy that may be able to help your aunt in having a better sleep at night without using medications. So this type of therapy has been shown to improve sleep outcomes and also long-term benefits in clinical trials. So perhaps that's something that you can look into for your aunt?
Yeah, I think that would be good because at least she knows we're trying to help her, right, and the risks of the medication. So I'll take that information. Thank you so much. Okay, and we'll discuss it as a family and decide how to proceed.
Okay.
Thanks
Do you have
again.
any other questions?
No, I'm great. But could I call you if I have other questions?
Sure. Yeah, anytime.